heart of northeast Nigeria, where conflict has cast a shadow over the land, another flare of hope emerges. NNPC Limited and Shell Petroleum Development Company of Nigeria Limited (SPDC), operator of the Nigerian National Petroleum Company (NNPC Limited), Total Energies (NAOC) joint venture in conjunction with Engrace Life Foundation, embarked on a health intervention project to bring improved healthcare accessibility to the people of Nangere and Potiskum local government areas of Yobe State. Recognizing the health challenges facing internally displaced persons, the project sought to address these issues through a multifaceted approach. Community engagement was at the forefront, with stakeholders including the Emir and ward heads, civil-based organizations, Yobe State Primary Healthcare Management Board, and healthcare workers coming together to identify key areas of intervention. Concurrently, efforts were on the way to empower local healthcare workers and extension workers through training sessions and capacity building initiatives. 25 community health extension workers were trained and equipped with branded vests and medical kits, equipped with medical supplies for the community visits. A train-the-trainer session held with 30 heads of facilities in areas of nutrition, psychosocial support, gender-based violence, and sexual and reproductive health. This training was later cascaded to 300 other cadres of health workers. The 25 community health extension workers, representing all the wards of the two local government areas, visited 3,341 households, with a total of 5,027 persons being treated for minor ailments. Community members who were required further medical treatment and surgeries were referred to the Central Medical Outreach for further management. The Central Medical Outreach was conducted in collaboration with the Nigerian Medical Association to cater for individuals who needed further medical and surgical interventions. 2,708 persons attended the medical outreach and were treated for various medical conditions, out of which 422 were booked for surgeries. From diverse ailments to surgical interventions, the medical team worked tirelessly to provide succor to those in need.
We express our heartfelt gratitude to our generous sponsors, the NNPC, NEPCO, joint ventures, our esteemed stakeholders comprising SEMA, National and Primary Healthcare Development Agency, NPHCDA. We extend our appreciation also to our valued partners comprising community leaders and facilitators, as well as the representative of our sponsor and dedicated team.
Alongside the Central Medical Outreach, a breast cancer awareness and screening campaign was launched, led by a courageous survivor and activists. A total of 973 women and girls were screened with the breast cancer screening device, and 12 ladies who were not cleared were referred to doctors for further evaluation during the exercise. Since the Central Medical Outreach, the 2 breast cancer screening devices have been donated to the community, and the breast cancer awareness and screening is still ongoing, moving around all the wards in the 2 local government areas. 600 men were also reached with prostate cancer awareness sessions powered by the medical team. The culmination of the medical intervention saw life-changing surgeries performed, restoring hope and transforming lives. The surgical outreach held in 2 locations over 4 days with a 27-man medical team. A total number of 424 procedures were carried out during the period. The surgeries comprised of 63 cataract surgeries, 101 hernia repairs, 23 lump excisions, including breast lumps, 157 dental procedures, and 80 refractive error procedures with corrective lenses given. The journey began with the groundbreaking ceremony for a new primary healthcare facility in Nangere ward, Nangere local government area. Despite current extensive inflation, the construction pressed on, driven by a commitment to serve the community. By November 2023, the construction of the new health facility was completed. The facility has since been fully equipped with state-of-the-art medical equipment and furniture, including a laboratory equipment, microscopes and autoclave, a scan machine, a delivery suite, and a fully stocked pharmacy. The 20-bed facility comprises of male, female, and children's wards, 3 consulting rooms, 2 bedded delivery suites, a laboratory, pharmacy, counseling room, an emergency procedure room, and a large well-ventilated indoor waiting area. Looking ahead, the project aims for sustainability with plans for ongoing support from the state government, Ministry of Health, and the Primary Healthcare Management Board and the Nigerian Medical Association. As we commissioned this project, our sponsors, NNPC Limited and the Shell Petroleum Development Company of Nigeria Limited, operator of the NNPC, SPDC, Total Energies, NAOC joint venture, expressed their delight in the successful completion of the project.
NNPC Limited is a socially responsible business that is geared towards the economic empowerment of the communities and the country at large. We are sensitive to the needs of the people, and our goal is to ensure that Nigerians benefit from the corporate social responsibility interventions based on verifiable and critically assessed needs of the various identified beneficiary states across the country.
Mr. Bala Wunti, Chief Upstream Investment Officer, NUIMS, who was represented by Mrs. Edith Lawson, Deputy Manager External Relations, NUIMS, said NNPC's vision for social intervention is to continue to operate in a sustainable manner and ensure that all individuals benefit from the business.
As a company, the Shell Petroleum Development Company joint venture is committed to contributing to sustainable development, and we have historically responded to communities impacted by disasters. It is therefore our sincere hope that this intervention will help to reduce health inequalities caused by the crisis in the Northeast.
Mr. Igo Wali, Director SPDC and Country Head of Corporate Relations, who was represented by Dr. Akiwumi Fajola, Health Manager, Community Health, said the project is informed by rigorous needs assessments in response to the humanitarian crisis in Northeast Nigeria. The project manager, Dr. Oluwatoyin of Embrace Life Foundation, appreciated the sponsors and all stakeholders involved in the successful completion of the project.
We have been able to get this project done on time and within the resources made available to us. And we thank our sponsors for that. The documentary has actually said everything, and Mr. Fajolu from Fajola, from our sponsors, has also reiterated everything that we have done.
Dr. Ipoade Omilaju of Sharimore Strategic Consult. The QAQC of the project implored the community members to keep, protect, and sustain the facility, as this is the thank you that the sponsors will appreciate.
We are thrilled at this commissioning of the primary healthcare project at Nangere, a social investment project informed by rigorous needs assessment studies in response to the humanitarian crisis in Northeast Nigeria. For this health intervention, which has spanned over 10 to 11 month period, the NNPC SPDC JV adopted a holistic approach.
The Executive Secretary of Yobe State Primary Healthcare Board, representing the governor, Honorable Malabuni, also appreciated the sponsors for their commitment to healthcare in the state.
And all these things are being done not only to demonstrate the commitment and seriousness of the Yobe State government, but also to ensure that we always are there to play our own role in improving the life and well-being of the population of people of Yobe State.
The community leaders also expressed their joy and appreciated the sponsors for this masterpiece that has been donated to the community. As the sun sets on this chapter, the legacy of the NNPC Limited and Shell Petroleum Development Company of Nigeria (SPDC), operator of the Nigerian National Petroleum Company (NNPC Limited), Total Energies (NAOC) joint venture will endure, a testament to the power of collaboration, compassion, and the resilience of the human spirit.